Hello, everyone. So I'm Patrick Wade. I'm here on behalf of the Champaign County Joint Information Center. We're a group of local public service organizations and healthcare providers who have come together to help keep you informed and keep you as safe as possible during the ongoing COVID-19 situation. Today is Tuesday, March 31st, and this is the first in a series of twice weekly videos we're going to bring to you with information about what we're doing in Champaign County and what you can do to protect yourself. But I don't want to delay in getting to our speakers today. In a moment, we'll hear from Julie Pride, who is the Champaign-Urbana Public Health Administrator. We'll also hear from Dr. Chuck Dennis of Carl and Dr. John Kreckman of OSF, who are the Chief Medical Officers for their respective organizations. And then we'll hear from Champaign County Sheriff Dustin Harmon, who will tell you about the countywide coordination efforts that are well underway. So Julie, I will let you take it from here.
Hi, we currently have 29 cases in Champaign County at this time. We will be updating those every day on our website, so please check that. We will have more information on percentages and a little more demographic information and locations of those cases, which will be new. I would really like to urge everyone to stay home as much as possible. We have sustained community transmission going on at this time, and that means that we don't know who has it, but we can assume that everyone has the potential to have it. So you need to consider yourself infectious and everyone else infectious. If you are doing the stay-at-home order, which we hope you are, this means that you cannot have people into your home as well. So unless you are a cohort of people living together, please do not have people into your home, and please do not gather. Okay, I want to remind everyone that about 80% of the cases that we see will be able to take care of themselves at home without any type of medical intervention. If you have symptoms and you are concerned, please contact your local healthcare provider for guidance. Again, I want to urge everyone to please stay home. Do not gather. Do not try to figure out ways to get around the stay-home order. The purpose of this is to stop the spread of the virus, or at least to slow it down drastically. Please wash your hands frequently and thoroughly. Please make sure that you, when you are out in public, if you have to be, make sure that the minute you come back into your home, you wash your hands and sanitize and clean all types of commonly touched surfaces. And please at all times remain at least 6 feet from any individuals. This is key because that is the distance at which we believe the virus can be shared. Thank you.
Thanks, Julie. Yeah, those action steps are obviously so important for us all to remember. We really need everyone's active participation to keep our community safe. Dr. Dennis, I'll go to you next. If you can tell us what's going on at Carl.
Yeah, thank you, Patrick. This is Chuck Dennis. I'm the Chief Medical Officer at Carl. First of all, I'd just like to thank Julie and her work throughout this process. Her leadership and advocacy for the social distancing, I think, has made significant impacts upon what we'll have to endure over these next several weeks. So I thank her for that. We continue our surge preparedness. We are looking at increasing the capacity of our resources in this region. We feel that we have the capacity to increase our ICU beds to at least 100 and potentially up to 200 in a surge situation. We feel in our collective hospitals across the region or in Champaign-Urbana, we can reach a total bed count of at least 600. We have other surge plans beyond that point should the need arise, but we're really trying to maximize the ability to keep individuals within the hospitals. Part of our work this week has been working on our manpower plan as we have reduced elective procedures and non-urgent visits to conserve protective equipment. We have a bandwidth of providers that we think that we can redeploy into other roles to meet the need that we see in a potential surge opportunity. We've also collaborated, as many of might have seen on the news, with the development of the Illinois Rapid Vent. It's a low-level pressure-cycled ventilator that we're in the process of going through regulatory approval and continued testing, and hope to create a manufacturing process that could allow that to be part of our armamentarium going forward and really deploy across the region for those low acuity patients as well. Really, our work is just ongoing. We have really enjoyed a very collaborative atmosphere across the region, working with a variety of partners, including Julie and Dr. Kreckman and the university, to meet the needs that we face. And I'm comfortable that everything is being done that can be done to meet the needs of the institution. I think this has only happened, though, in the efforts such as what Julie's been describing. As we socially distance, what we've found is that our surge is at least being delayed, which gives us more time to prepare. But hopefully the peak of it is also being diminished to allow us to be able to handle the surge with our current capacities. Please keep up your efforts. I know it's a hardship on everybody, but it's probably the most important thing that everyone can contribute to right now.
Sounds good. Thank you, Dr. Dennis. Next, we'll hear from Dr. Kreckman at OSF.
Great. Thank you, Patrick. And thank you, Julie and Dr. Dennis. So good afternoon. My name is John Kreckman. I'm the Chief Medical Officer at OSF Healthcare Heart of Mary Medical Center. So similar to previous speakers, I want to thank the community for its support. The generosity and donations have been remarkable. Remarkable, but certainly not surprising, based on the quality and the compassion of the people in East Central Illinois, whom I've had the pleasure of knowing almost all of my life. So first, I just want to assure our listeners that the health and safety of our patients is the number one and only priority of OSF Healthcare. And it's important to remember that hospitals treat patients with infectious diseases every day. So we're not starting out of the box with something brand new. We're simply taking what we've learned over years and years of experience and applying it to this unique situation. And as Dr. Dennis intimated, being in the Midwest, we are blessed. We've had a lot of time for planning, for advanced warning from China, from Italy, from Spain, and even what's happening on our coasts. So be assured that the planning has been going on for weeks to prepare us for this, for our current situation. So along with our community partners, we have implemented our incident command. We have started enhanced screening for our mission partners and our patients, and we have restricted access to the hospital, all to make this a safe place and to keep a close eye on the situation. We have contingency plans that are scalable based on the community transition levels. And we have adequate capacity not only to deal with our current transition levels in our community, but to scale those up as the situation changes. As many of you are aware, current modeling anticipates the levels will increase over the next few weeks. And as we are meeting with, we've had a series of meetings with our community partners, and are continuing to collaborate to assist each other through the next several weeks as the transmission levels change. And it's important to keep in mind that we're not only focused on our community, but with OSF providing healthcare over a large portion of the state, we have deep resources to pull from throughout the state as transmission levels vary throughout our community and our state. So if Champaign and Urbana is particularly hard hit, we can certainly pull. We can only scale up our own internal plan, but we can also implement and pull from resources statewide. So, as previously stated, the most important thing that our listeners can do is to be prepared. And we just want to stress two things. Number one, take this seriously. And it's obvious to me as I look out my office window You know, the empty sidewalks and the empty streets, the people are taking this seriously, and that's a significant source of reassurance and pride in our community. And as Julie said earlier, you know, as you go out to practice that respiratory etiquette and make sure you go through that risk-benefit analysis, not just for yourself, but for the other loved ones in your house and in our community. If you need to go out, but continue to practice that social isolation. But if it's not necessary to go out, try to stay in as much as you can. Second thing I would say that we can do is to stay informed. And I can give you 3 good ways to do that. If you go to the osfhealthcare.org website, we have Claire, the chatbot, who can walk you through whatever symptoms or concerns you might have and walk you down the path that and put you in contact with a healthcare provider to answer your questions. We also have OSF COVID nurse hotline, which is at 833-OSF and then 5669. So 833-673-5669. That's a 24-hour, 7 days a week hotline that you can get in direct contact with a person to walk through those symptoms. Once again, if you have concerns, it's always best to call to see if you need to go out rather than to just head out. And certainly, as we all know, these have been certainly unique times with certainly amount of stress associated with that. So it's that same website, the OSF Silver Cloud, is a place that you can go to give you tips on how to handle the stress associated not with the news that you're watching every day, but also with the quarantine that you're going through, and to give you tips to handle that. And if you do need additional support, it can direct you on how to get that support. So just in concluding, we have a very good internal plan at Heart of Mary. We have a very good community plan with our healthcare partners, and statewide we are closely monitoring the situation, and we have a large pool of resources, not just in supplies, but also in providers and support network to pull into the community should that become necessary. So just if everybody could do their part, staying informed. We're going to be partners in this together. And as we do partner together in this, we will have the best outcome that we could hope for. And we're here if you need us.
Sounds good. Thank you, Dr. Kreckman. It certainly sounds like we're on the right track there. And Sheriff Harmon, I know you wanted to tell us about the ongoing countywide collaboration.
I'm Champaign County Sheriff Dustin Harmon, and I wanted to take a moment to thank all of you who have proactively helped to mitigate the spread of COVID-19 in our county. While most of us who contract COVID-19 will have mild symptoms, it's also important that we pitch in to keep the virus from getting to our most vulnerable populations. The recommended social distancing and congregation restrictions aim to do just that. The current social distance is at least 6 feet from a person who does not have a fever, cough, or sore throat. Champaign County is known for coming together to work proactively towards mutual goals, and COVID-19 pandemic is no different. Even before the first positive COVID-19 test in our county, we were setting the framework for collaboration and coordination between multiple agencies and community organizations in Champaign County. We have activated a joint operations center so that the coordinated effort can continue and can be managed by those who can help mitigate the effects of the virus. The EOC connects elected and appointed community leaders, leadership of the University of Illinois, and our interconnected health system with the most up-to-date information available so we can address our current needs as well as help plan for our future needs. This is an unprecedented situation for all of us, and we have to work as a community to overcome it. Please follow the guidelines of the CDC and our local health professionals as if someone's life depends on it, because it might. When this is all over, we will look back and realize why we're proud to live in Champaign County and blessed to have community leaders who have the best interests of their communities at heart. Stay connected with factual information and stay virtually connected with loved ones. We are all in this together.
Thank you, Sheriff. So that does it for today's updates, but we'll be back later this week with more information. Please follow the Champaign-Urbana Public Health District on Facebook and Twitter for regular updates. And if you have any specific topics that you'd like to see covered in these videos, leave those in the comments and we'll take a look at those. Remember to stay at home as much as you possibly can. Don't think of it as being stuck at home. Think of it as being safe at home. And we want you to know that we're here to support you and keep you safe. So thank you for watching, and we will talk to you soon.